All right, guys. Hiya. Welcome back. I know I haven't done a video in time, but you guys know how it is as a medical student. You don't get that much time to do as much as what you want to or expected to do. So, apologies for that. I don't really think anyone cared anyways. I don't think anyone watched my videos enough to warrant more videos coming out. But I thought I'd just come back to do a third year overview now that I've successfully finished third year back in July. And I thought I just wanted to do an overview about, what you're expected to do or learn in third year. What are the important subjects? How you're going to tackle them? What kind of sources would I recommend as a student? So yeah. So third year is all about picking your losses. Picking your losses, what I mean by that, you're going to be studying a total of around 12 subjects, maybe 11 if you don't count the one subject that actually isn't an exam, an examined subject. But it's all about choosing which is important and which isn't that important or that essential to your own learning. So it's all about separating core from additional accessory. So things that I consider accessory subjects that it might not be accessory to you, but that's how I thought of it throughout the year. So things like occupational disease and toxicology. I mean, sure, if you like toxicology, maybe it's something interesting to you and you want to learn it properly, fine. But is that clinically relevant? I'm not sure. Hygiene, it's the most boring subject that you're going to be doing in year three. It's all about requirements of certain things and whatnot. But it's not that really relevant. But I have to warn you, it is a state exam at the end of the day. So make sure that if you have any notes that you're making throughout the year for it, store them because you're going to be using them for sixth year potentially. Then we have disaster medicine. This is probably the worst exam for me, preparation wise, just because it was a headache to go through. And yeah, some parts are interesting, but things like earthquakes and whatnot, I don't know, it just wasn't that relevant to me as a future doctor. And any subjects, like I said, which don't have a final exam in that particular year. So pharmacology, general pharmacology, you get examined for that in the winter semester of fourth year, not third year. So, if you like pharmacology, I mean, because I had a pharmacology background or pharmacy background, and yeah, it did have a good grasp of me, but if it's not going to be examined that year, put your focus and shift your focus towards subjects which actually will get examined in that year. So in terms of the core one subjects, which I like to call it, so I've grouped subjects based on core one and core two. Core one meaning, these are the subjects which should be at the top of your priority list. You should be putting the most effort and time towards, making the most effective notes for, or whatever. And, we should be aiming to get as high as you want here. And so yeah, in terms of my priority for that, based on my experience, my perspective, so this is what I felt like were the most important subjects. It might be different for you. If you're a, for example, surgery nerd, you might put this as number one. But for me, pathophysiology by far should be the gold standard at the highest level of any subject in your degree. Why am I saying this? Because it's the foundation. Literally, if you know pathophysiology, you know how to treat a disease, you know how the causes of the disease affect the individual, you know how the mechanisms change the individual. And when I was in my NHS placement in the summer, all I was talked about and asked about was what is the actual pathophysiology for this disease? What are the causes for this thing? Because if you know the pathophysiology, like I said, and what the doctors also agreed with, you know, you know, you know everything. So definitely focus on that. And then you have internal medicine, general surgery. So these are introductory courses in third year, but obviously, they go hand in hand. Medicine can be split into internal and surgical. And of course, if you know the basics, which will be taught to you in this third year, then fourth year will be piece of cake and whatnot. And then you have radiology, because I only put this here because you'll get asked. Well, in my NHS placement in summer as well, I was asked a few times, can you interpret this image? And I felt like I had to use a lot of my radiology knowledge to do that. So that's why I put it as number three. Again, guys, it's really subjective. If you think that radiology is not that important to you, fine, put it somewhere else, put it at the bottom of the bucket list. But if you feel like it's relevant, if you feel like a certain subject is relevant to you, if you feel like radiology is actually your favorite thing, you can put this as number one. Yeah, but this is what I thought was the most important thing, and a lot of students might actually agree with me here. So, and then there's a core two subject. So these are subjects which aren't as hard on as a core one subject, but they I put them here because they might be hard or they still carry a bit of relevance as a future doctor. So social medicine, I'm not gonna lie, it's a tough subject. you're going to be taught it as well in 6th year, and you're going to be assessing it on 6th year. And there are some elements of that subject that are actually quite relevant to your NHS career or wherever you want to work in the world. So things like the different types of healthcare systems, like primary, secondary, tertiary, that might be something that's relevant that you're going to be using, obviously, in your future career. And another thing as well is that the teacher, the head professor of social medicine, he's a bit on the harsh side. So I don't know, that might be a motivation for you to try and avoid, being long with him. So yeah. And then you have pathology. So pathology is split into general and clinical. You get taught general in the winter semester, and then you get assessing it in the winter semester, and then you move on to clinical pathology. But if you know pathophysiology, like I said, it's the foundation, then this subject becomes easy. And if you know histology, which is from last year, from year 2, then actually this subject is really easy and everything sort of links in together. And microbiology, that's being taught in the winter semester 3rd year. That is also relevant. We talked about in the summer placement I had, was all about antibiotics and what kind of treatment would be using for particular inflammations and whatnot. In microbiology, you don't actually get taught heavily the actual antibiotics, but you do get taught the different types of bacteria, and obviously that's equally as important. So definitely focus on microbiology when it comes to it. And in clinical lab, so clinical laboratory. So these are all about clinical lab values, so things like sodium levels and whatnot. It is important, obviously, and that's all you see in placements as well. You're always going to see, the blood tests and whatnot. But the subject itself was taught in such a niche way. Like they'll tell you that there's like the 6th line of how to diagnose a particular like value or whatever. So it doesn't have to be that deep. Just know the fundamentals at least. For example, CRP, which is a key marker of inflammation. That's all you need to know. You don't have to know much more about it than that. And they're going to make you learn the values, memorize values. But let's be honest, on the ward, you'll get given the reference values. And a lot of the softwares these days actually have like automated up and down sort of markers. So it tells you if a value is high or low anyway. So, obviously it's good to memorize the values. Why not? But, don't let it stress you. And guys, so the formula is the same as any exam that you've done in year 1, year 2. Grab the syllabus first. Why? Because this is like the Magna Carta of your subject. It's going to tell you what exactly you're going to learn and how you're going to be assessed by the end of by the end of the semester or whatever. So understand as well the format of the exam, because that's obviously going to influence the way you're going to be revising towards that exam. And my advice is when you get the syllabus, always group it or group the different individual essays based on their similarities and themes. So I've got an example here. This is a part of the pathophysiology syllabus, and you can see from 29 to 34, ignore the highlights. I've put that as the respiratory module, and then I've grouped some essays into the cardiology module, and then a few ones in the hematology module. That might seem like all right, fine, but it's good for you to know, okay, for example, for your own personalized revision, by the end of this week, I want to focus on the respiratory module, or I'm weak on the hematology module, let me work on that, or I'm weak on the gastroenterology module, let me focus on that for a bit. So it's a good idea to see what your weak points are, rather than just doing, essay 1 by 2, 3, 4, 5. It doesn't make any sense, So obviously, guys, tailor your study techniques, like I said, to the exam itself. If it's an MCQ exam, obviously just do MCQs. It doesn't make any sense to make notes when it's just going to be an MCQ exam. Maybe notes can help, but in terms of being efficient with your time, as you should be with a medical, as you should be as a medical student, it's all about doing what you can for a particular exam. If it's an MCQ exam, do MCQs, okay? If it's a short answer exam, like pathology is actually, so it's going to be 10 short answer questions in the exam for pathology. Make your own practice questions. For example, what is the development of atherosclerosis? Draw the development of atherosclerosis. Or what are the 5 types of or what are the 5 types of necrosis, for example? Describe the types of necrosis. You know what I mean? And if it's an essay-based exam, an oral exam, these are the exams which require you to have a deep understanding of the topic, more deeper than the MCQs would or the short answer questions would. So draw mind maps, like I've always advocated for on my page and on YouTube. Draw diagrams, implement Feynman technique, teach people, that's going to be the best way for you to process information deeper and be able to express it when it comes to the orals. And like I said before, any values, clinical lab, any images like radiology, which is all about patterns, to be honest, stick them on Sankey. And then we have the core one subjects I'm going to talk about now. So I'm only going to talk about the core one subjects here, only because if I waffle for every single subject, you're not going to listen. So let me just put down the core one subjects and how to tackle that. So pathophysiology is, like I said, the gold standard, the foundation of your whole learning, not only as a student, but as a doctor as well. So in year two, you learn about physiology. So that's just about how the body works in a normal, functional, healthy state. Now, pathophysiology is all about what happens when the body goes wrong and how the mechanisms change as a result of being in a diseased state. So patho means disease. And the format of the exam is standard. So it's MCQs. I think it's 30, but I didn't do the MCQs. I'm not sure about that. But it's pretty much, word for word from the online website that they have, which is a whole bank of MCQs which you can use. And I've used them obviously myself to prepare for colloquiums and my own learning. And then you have two essays, which I picked at random, one from the general part and one from the special part. So what essays 1 to 27 will be all about the general sort of aspects of pathophysiology, things like inflammation, diabetes, hypoglycemia, water balance, cancer. And then the special part is all about specific systems that are being affected, like cardiology, respiratory system, gastro. And you have 2 hours, so obviously, naturally, you should be doing 1 hour for every essay. And then if you're successful, you go to the oral. The oral is challenging and it will challenge you to, branch from different topics and bring them all together. But yeah, and it is like a stop format. So if you fail on the MCQs, you stop on the MCQs. If you fail on the essays, go back to MCQs. If you fail on the oral, you go back to all the way back to MCQs. Yeah. So general tips, the practicals. The practicals are the best way to understand what it is that the teachers want from you. Because bear in mind, these are the teachers who are specializing in the field of pathophysiology, not pathophysiology specifically, but for example, sports medicine, and then they will link that somehow to pathophysiology, or for example, neurology or sleep science, and they will bring that somehow to the pathophysiology of, how obese patients, have something called sleep apnea. And, that's a whole different video that I can talk about. But um, yeah, always make notes of what the teacher loves to talk about, because I remember when I was in semester two, the teacher was talking about something called Dressler syndrome, and I had no idea what that was. And the information is a bit sparse or scarce, should I say, on the internet. So, and then when it came to the oral, he asked about Dressler syndrome. So I know that that's something that he wants to hear in your essays or in the oral. So, always take note of what the teacher says, really. And obviously take the opportunity to ask your teachers as many questions as you have in your mind as possible, because pathophysiology is a really broad subject. It's really intricate. It's all about the fine details. How does this mechanism affect this mechanism? So, ask your teachers, don't be afraid. Ask them, they'll actually respect the fact that you ask them, because it shows you're curious about the subject, and they'll actually offer you much more signposts and resources to try and get you to the answer that you want if they can't answer it themselves. And yeah, and like I said, this subject is all about linking. So the best way to be linking things together and related topics that I've advocated for so many times is concept maps or mind maps. Why? Because you're going to be expected to go from hypoxia, which is a subject in pathophysiology, all the way to diabetes. How do these two link in? How does inflammation link to COPD? How does COPD link to a heart problem? How does a heart problem lead to shock? I don't know, things like that. You know what I mean? It's all about linking. And obviously, pathophysiology, because it requires you to have such a deep understanding of the topic, the best way to do that and to achieve that is by teaching. So obviously, teach people, teach your friends. If you've got no friends, teach yourself. Use a mirror. Make recordings like I'm doing now. I'm basically talking to myself now before I upload it. But always always teach, because teaching requires you to package the information and deep process it within your mind in a way that will be understandable by that person. Yeah, even if you're not going to teach someone like physically, you putting the effort to do that is learning in itself. So definitely do that if you can. And eventually, or sorry, obviously, in general, never lose sight of the big picture. Always, when you're learning like the really fine details of a particular topic, zoom out first and be like, okay, what is the whole point of me learning this anyways? You know, for example, if you're learning about a particular mechanism of how CPD works and you're getting lost in the jungle that you're trying to go through, go back and be like, okay, why am I learning about this? You know, why is this important? What even is COPD for me to be, you know, why should I be learning about COPD anyways to know about this particular fine detail? And eventually everything will just open up and make sense. So again, like I said, guys, your brain doesn't really think in lines of text. It's not your brain process. Your brain processes in ways in which it's all about networking and branching off. So here you can see that I've made a mind map or a concept map on this topic is specifically about thrombotic diathesis. So that just means clotting diseases. So with the help of the teacher, he made us divide the different types of clotting diseases into 4 categories. And I've basically just done like a little diagram about the bloodstream and how this part is affected and how this part of the mechanism is affected, and it brings everything in. You wouldn't be able to see that or visualize that had you not done this and stuck to the linear notes way. So recommended sources that I advocate for, again, like I said, the seminars are important. Semester 1, I highly recommend you use the Porth's pathophysiology book, because in semester 1 it's all about the general sort of aspects on pathophysiology, and this book is really good for that. So things like inflammation, diabetes will really talk about very well. When it comes to semester 2, you can still use Porth's, of course, but I found halfway through the semester I found a decent book, and it's called Copstead, and it's more specific about the systems themselves, but you can get away with using Porth's throughout the whole year. It's fine. And bear in mind, guys, the teachers will, nail down that you should be using textbooks as much as possible to get information and not just rely on their seminars or rely on lectures. Lectures aren't enough, by the way. You have to be able to go back home yourselves or to the library and try and grab as much information from different sources. That's called cross-referencing or synoptical reading. That's what it's called. You bring all these sources together and make a whole, big picture learning, like I mentioned before. Then you have YouTube, so Osmosis, Ninja Nerd, things like that. Ninja Nerd's always going to be the GOAT for when it comes to general YouTube, medical education. Research medicine's decent as well. And then lectures. Yeah, lectures are all right. Depends on the lecturer, depends on the lecture. But generally that should be at the back of your mind kind of thing. And if you have additional time and you're curious about a particular subject, the professors really like if you actually bring in research article sort of information. And I actually mentioned a thing from research articles and clinically relevant papers into my essay in the final exam, and they were very impressed by it. So, there you go. But if it's going to hinder your actual learning, don't do it. Don't do the research articles. Just focus on the basics first. Don't put additional pressure onto your mind that's not needed. Now we're going to move on to internal medicine. So internal medicine, okay, I want to make a disclaimer first, guys, that I know before you enter third year, everyone's obviously going to be thinking like, wow, I'm going to start clinical years. It's going to be like really fun. It's going to be cool. I'm going to be at the wards. You know what I mean? I'm going to feel like a doctor for the first time. It's not like that. It's not really like that, I'm going to be honest. It depends on the teacher, because the teacher themselves obviously dictate how the whole environment is. But the departments for the specific clinical subjects in this year, they're not that organized. Just going to say it straight up. So it's what you make of it. That's actually the biggest thing about Plovdiv in general, is that it's what you make of it. If you independently put the effort in, this will be an amazing degree, amazing course, amazing subjects. But yeah, so it's very anticlimactic about the feeling that you get before third year that you're gonna, be in scrubs, stethoscope, yeah, and it's calm down. It's not super like that. But generally the principle's still there. Internal medicine, it's less about pathophysiology, but pathophysiology actually is relevant here in some capacity, because if you know pathophysiology, again, like I said, you know what kind of signs and symptoms you're looking for in a person. So this subject is more about how to perform particular techniques like inspection, palpation, percussion, and auscultation, which is what IPA stands for. You're going to be interpreting ECG, some heart murmurs, and I have videos about that on Instagram if you want to find out. And yeah, but mind the format is an MCQ exam, so that will obviously influence the way you study for the exam. It's going to be really MCQ heavy, but obviously keep the principles of the subject there. You know what I mean? So generally, like the tips that I recommend here is that it's an introductory course, right? It's called Propedeutics of Internal Medicine, which means introduction into internal medicine. So they're not asking you to be a absolute G by the end of the year and being able to know every single ECG, means. Obviously not. Know the basics of ECG, for example, the PQRST, ST elevation, what does that mean? Myocardial infarction, things like that. And obviously, once you're on the ward, take every opportunity that you can, especially if you know Bulgarian, or even if you don't know Bulgarian, take opportunity to do a medical history or or perform a medical technique like palpation of the abdomen. Because those opportunities are actually quite golden. I know I got tired of, because I was the only one that, not the only one, but one of the few students that knew Bulgarian in my group. I was always the one doing medical histories, and yeah, they were good for the start, but eventually I got tired of it. But they're good opportunities for you to solidify your practical skills. That's what half of being a doctor is. It's all about your own practical, dexterity and skills and techniques. That's what makes you, truly a doctor. You can learn as many books as you want and many exams as you want. If you don't know the basic techniques like this, there's no point. So sources I recommend is, because it's an MCQ exam, definitely use the PMU MCQ book, use past papers or variants as they call it. Use the theory book that they bring out as well, and YouTube. Geekumenics is a very, very good resource that I recommend using, especially because it's relevant to NHS and UK. So if you know that, then you be more prepared for going back to the UK. Then you have general surgery. So general surgery, again, it's the same with internal medicine. It's a bit anticlimactic. It's not what you think, like, oh wow, surgery, I'm going to wear scrubs and go into theaters. Yeah, you might be entering a theater here and there, but it's not how it seems to be from the outside. So it's all about the introduction into the basic sort of foundational elements of surgery. Things like, what is the organization of a theater, general and local anesthetics, what hernias. It's less about treatment of those surgical conditions. So things like hernias, you won't be expected to know the treatment, maybe on a basic level, but nothing crazy. You'll learn about different congenital anomalies, but again, less about treatment. Maybe on a basic level, like I literally just said, but again, don't go, into the fine details, because that's what the whole point of special surgery, specialized surgery, and all your state exams are all based upon. And it's more about identifying what the conditions are. So knowing what a hernia is, what are the symptoms of a hernia, what are the different types of hernia, what makes one patient with one type of hernia different from another patient, what does one patient with appendicitis mean from another patient, things like that. The format is a standard MCQ, but bear in mind these are quite tough. They get changed here and there. Some of them even have clinical case questions, so get ready for that. And then you're going to get asked to do a essay, so a random individual essay each. Every person gets their own essay. You write down as much as you can in a concise way, and then you have the oral. And the oral actually contains a practical part. I forgot to mention in internal medicine there's also a practical exam as well, but don't stress that too much. And the general tips for this exam is that if you know your pathophysiology well, and you know your anatomy knowledge well, which is highly required in surgery, then this is a passable exam. Because pathophysiology, like I said, it's all about causes, treatment, and whatnot. So this links in very well with surgery. For example, if you know what atherosclerosis is from pathophysiology, then you know what aortic dissection and aneurysms are in surgery. So try and learn as independently as possible. Why am I saying this? Well, because like I said before, the departments are a bit disorganized, which I don't blame them for, because obviously you're going to be studying you're going to be going to hospitals to do your seminars, and obviously they are still doctors, they have responsibilities, so they might not be with you all the time 24/7. What I recommend to do is just go home and learn the topic as much as you can yourself, and then add the fine bits from what the teacher's trying to tell you. So discuss the teacher, like, I learned this topic, individually, what do you think? You know, or even the teacher might actually ask you to present the topic, and he will tell you, what you're missing. So the sources I recommend is things like lectures, because there are some niche things that you won't, if you Google these sort of niche topics that are talked about in the course, they won't come up on the internet. So what you should be doing is going to these lectures. I think they're 7:30 a.m. So I don't blame you if you don't go to them. But especially if they're Stefanova ran lectures. So if they're taught by Stefanova, those lectures, I highly recommend you go to them, because she's expecting you in the final exam to regurgitate or express that information that she said word for word, even, because she's got a very unique way of describing a particular condition, famously acute abdomen. And then you have different textbooks, Bailey and Love, Schwartz. I didn't really use it that much, but if you want a source, there you go, and YouTube, of course. And then finally, radiology. So radiology is split into two parts. The first part is called nuclear medicine radiotherapy. It's a very short module in the whole radiology course, but it is important. I guess it's important because you have to do an MCQ in that section actually, and then the final exam. It's all about like gamma cameras and radionuclides and things like that. Then you actually have radiology itself, which is all about image interpretations. Like it's called imaging diagnostics actually. So you're given an image and you're expected to know what is going on basically. And like I said before, it's a very clinically important skill, because you're going to be in hospitals. Like I was in hospital not too long ago in NHS, and I was asked, what is this X-ray of the lung showing? What's going on? What is the potential diagnosis? What could this tell us? So the format of the exam is initially a radiotherapy MCQ. This is done on a separate day to the radiology or the imaging diagnostics exam. So you have to pass that exam to get to the next stage, which is radiology. And then you have the MCQs in radiology, which is on another day. And even though it has three options, it's tough because the two options are actually quite similar. So you have to do a gamble of, which one's the right one. So definitely, nail down your MCQ, techniques and knowledge as much as you can. And then you have the image interpretation stage. So if you pass the MCQs, you wait for a while, you go in back to the hall, you sit next to an individual teacher. They will give you an image randomly from a ticket that you hold, that you get. Let's say I've got number 18. The teacher will get a number 18 on his laptop, and he or she would say, okay, interpret this image. You say what your findings are. You say what the differential diagnosis are. Bob's your uncle. The general tips is practicals, practicals, practicals. There's nothing else that you should be using other than practicals, because the MCQs are assessed based on the practical knowledge. The images and the different, the images, obviously they're not going to be, carbon copy the same image. They might be actually, but they just give you a very good idea about what you're expected to know when you go into the assessment. And obviously Radiopedia, if you want additional images and additional information, but like I said, the practicals is sufficient. All right, guys, so if you have any other hesitations or concerns, please don't hesitate, just comment here on YouTube. You can talk to me on Standing Learning on my Instagram, TikTok page, or even my personal, which is Instagram as well. So yeah, I hope you've found this video somewhat useful, and yeah, hopefully see you very soon for another video. But yeah, I apologize guys for not making a video anytime sooner, but you know how it is as a medical student. Take care, guys.